My name is Alex Hughes. I'm a spine surgeon here at Hospital for Special Surgery. I see a range of patients from adolescence to old age, and I treat a diverse array of conditions ranging from degenerative pathologies, congenital issues, and also more complex deformities of the spine. Choosing and recommending the right course of treatment for a patient is a fairly complex process that involves not only a very careful study of a patient's past medical and past surgical history, but also a careful understanding of their present health status. In other words, it's not just as simple as looking at an x-ray of the spine, but understanding the integrity of the patient's connective tissues, ranging from bone, ligament, tendon, to the paraspinal muscles that support the spine. With that understanding, we can confidently recommend a surgical intervention that is going to suit that patient's specific condition that will guarantee the best possible long-term outcome. Minimally invasive surgery is a very important concept. It involves applying a surgical or structural solution to a patient's spine and his or her problem in the least invasive or least destructive way possible. And that can range from using a microscope to make small incisions and preserve the surrounding muscle tissues to using selective fusion, for instance, in the middle of a complex deformity to solve the most unstable or critical component of a patient's spine. Ultimately, the goal is to sparingly use surgery to apply a solution that will give the patient a long-term good outcome. Well, follow-up in clinical care after spine surgery is very important. And when possible, we carefully follow patients in person here in New York. But luckily with technology, we now have the ability to have a global reach. And so it's very common for patients, even after complex surgeries, to return to their home city or their home country. And through virtual or telemed follow-up, as well as with partners sometimes in the local environment, we can obtain imaging as needed during the postoperative period and engage fully via video to help facilitate clinical care even when patients have returned home. When I have a patient who has achieved success, there's no greater reward, because not only do we feel then confident that we made the right decision, but I get to share in the well-being of our patients. And I always tell patients, outside of themselves and their immediate family, there's no one in the world that cares more about them having a long-term successful outcome than myself.